More good news with regards to the vaccine. Hitting 10 million is a fantastic moment. And also this new plan to try and explore whether we can mix and match the vaccines as well, and potentially what that could mean to all of us. The idea for that, I think, is happening now, and it's going to get the results in the autumn. What are the implications if we find that there is a positive outcome?
Yes, absolutely, Ben. So the UK remains at the forefront of COVID vaccine and, of course, research overall. And this piece of research, we're putting £7 million to work through the Vaccines Task Force to these scientists who are looking at how the impact of mixing vaccines, which is, by the way, historically done on other vaccines. So hepatitis vaccines have been mixed, of course, with children with measles, mumps and rubella and polio. It won't impact, of course, our deployment program, because it's important for your viewers. If you've had a Pfizer vaccine, you'll get your second dose within 12 weeks of Pfizer. If you had Oxford, AstraZeneca, you'll get your Oxford vaccine within 12 weeks. This is to look at how we can sort of be even more efficient for the UK, but also for the rest of the world. Because the one thing to remember is we will not be safe, even if, as I will absolutely do, deliver that mid-February target for the most vulnerable 4 cohorts, and then keep going of the 9 cohorts in phase 1, and then keep going beyond that, and every adult is vaccinated. We still have to make sure the rest of the world is also vaccinated. And this research will help us understand how we can use vaccines more efficiently.
We had great news this week, because the AstraZeneca vaccine was shown to have incredible effect, not just on the impact of serious disease on those who have taken it, but on transmission. And also bolstering the fact that you have extended the time between doses from 3 weeks to 12 weeks. The last time you were on this programme, Mr. Zahawai, you told us that when it came to the Pfizer vaccine, there was data which showed that the 12-week gap was affected, but that hadn't been published. And I wonder whether we're any closer to that, or any closer to us as the public seeing, in the same way as we've seen with AstraZeneca, the impact of that 12-week gap when it comes to the Pfizer doses. Because people are still concerned that it may not be the same impact.
So our regulator, the MHRA, and of course the Joint Committee on Vaccination, and the Deputy Chief Medical Officer, Jonathan Van Tam, and the Chief Medical Officers of England, Wales, Scotland, and Northern Ireland have looked at all the data, including data from the manufacturers that isn't in the public domain, and they are absolutely certain that this is the right dosing strategy, and will continue on that strategy for the deployment. The AstraZeneca...
Can we expect something from Pfizer to back that up, in the same way that we have this week had that incredibly positive news from AstraZeneca?
Well, what Pfizer have said is that it is up to the regulatory authority in each nation to make this decision. And our regulatory authority has looked in detail at this, as have the Joint Committee on Vaccination and Immunisation and the Chief Medical Officers. And I think it's the right thing to follow the expert advice of all those great scientists and experts who know what they're doing, to say, actually, the 12-week, up to 12-week dosing regime is the right one.
OK, so now, it's not the recommendation of Pfizer themselves, though, is it? It's a scientific assumption that has been made.
Well, it's a scientific view by experts in our country, including our regulator. But the important thing is Pfizer has said that it's up to the national regulator to make these decisions, and we've made that decision. If you look at the data that they have released, there is very high levels of protection after 15 days, even higher as you get to 21 days on the Pfizer-BioNTech vaccine. And as the Deputy Chief Medical Officer has said, and Chris Whitty has said, in terms of public health, if you've got 2 jabs that protect you with first dose after 15 to 21 days to 89%, do you give both to one person, or do you give one each to protect 2 people?
Yeah,
and that's what we're doing.
I understand the rationale of, handing out more jabs. I still think for many people there is a data gap between 21 days and 12 weeks. You say it's in unpublished data. Again, I say, if we could see the data, like we did with AstraZeneca, that might improve public confidence. I just want to talk to you about something that Nicola Sturgeon, the First Minister of Scotland, has just told us. In Scotland, they've been accused of having a sort of stuttering vaccination programme. And, you know, there's an admission that the numbers go down on Sunday because GP surgeries are largely not open to vaccinate people. But she made the point that in Scotland, for older care home residents and those over 80s, they are measuring not just those who have been offered the vaccination, but those who have taken it up. Now, when we spoke to the Care Minister, we were told that everybody in that particular group had been offered the vaccination. But unless people take it up, and particularly vulnerable groups and particularly care home staff, then those vaccination figures are flawed, aren't they?
So what we're doing to hit our mid-February target, so already we know from the data that 90% of over 80s in England have had the vaccine, 90% of over 75s and about 50% of over 70s. This week, we're now going through with GPs, as you quite rightly mentioned, because primary care is a big part of this deployment, as well as hospital hubs and national vaccination centres, going through their population and looking at exactly who's been vaccinated, who's been offered the vaccine, and what is remaining, so that we can actually make sure that each and every one of those is offered the vaccine by mid-February. The good news is uptake in those first four categories is incredibly high. There are areas of work, you're right. So you look at the residential care homes for the elderly, the staff have been really good in terms of coming forward to be vaccinated when GPs have gone into those care homes, and we've done over 10,000 to meet that target. But we're also offering them vaccines at hospital hubs and their GPs to make sure we raise that number as well. And of course, communicating to the hard-to-reach communities, the BAME community, to make sure that we get the message across. You know, you've seen vaccinations. I saw your piece earlier from Selhurst Park, in temples, in gurdwaras, in cathedrals, in mosques.
But unless people have the vaccine, then the vaccine programme and the figures don't tell the whole story, do they? As Nicola Sturgeon makes that point, people, particularly those who are vulnerable, need to be vaccinated.
Absolutely right, Susanna. You know, the United Kingdom is, we should be proud of this, the ONS, the Office for National Statistics study, has us at the highest acceptance in the world as a nation. 85% of people say they will very likely take the vaccine in the UK. Okay. The 15% skews heavily towards BAME communities. And I do worry about that, which is why I'm spending a lot of time and resource and effort, as is the NHS, to make sure we target those groups, because the virus can find a home, and if the majority of the of the adult population is vaccinated, but particular communities are vulnerable, then it will infect them and go through them like wildfire, which is why we're spending a lot of time and effort doing this.
Can we talk about quarantine, hotel quarantine, when people land from foreign countries? It was a policy that was announced a few weeks ago, and yet we keep getting delays as to when it's going to come about. Can you give us a clear understanding of when that's going to be implemented?
Yes, Ben. So next week, the Secretary of State for Health will be setting out the operational elements of this policy. It's one part, it's worth remembering, this is one part of a much bigger border policy. So people already now have to have a test before they leave their country to come into the UK. The countries that are now no longer allowed to come to the UK because of the variants we're seeing, that's been implemented. And of course, the passenger locator form is in place, plus a 10-day quarantine is mandatory.
It's one of those, if I may, sorry, it is one part, as you say. It's one of the weapons in the armoury for protecting people when they land, of course. But what we know is that it's a pretty strict part, but it's a very effective part, because if we get these travellers landing and we can keep them in one place, we know exactly where they are, and we know that they can't leave until they have tested negatively. You're talking about the fact that people have to self-isolate when they land for 10 days, 12 days, but we also know that there are 20,000 people out there that have tested positive for COVID-19 and aren't self-isolating. For whatever reason, they don't feel like they have to, or financially they can't afford to, and they have all sorts of factors that are stopping them from doing that.
That's what Dido Harding, who's head of the contact tracing system, told MPs yesterday. 22,000
cases have been investigated with regard to people not self-isolating, but only 330 fines in England and Wales were administered by the police this week to people that weren't following the rules. So as you say, it's an important part of the armoury, but it feels like, for all of us watching from the outside, the best and most strict way of actually protecting the spread of the virus from people coming into the country.
Look, you're absolutely right that this is one part of the programme. By the way, there's been 43,000 fines. You're right, yeah, maybe 350 this week. And what Test and Trace now can do, which has 800,000 test capacity a day, is making a huge difference. 7 million people have been identified and have self-isolated through that infrastructure that Dido and her team with the NHS have built. But you're right, and we will absolutely be setting out how the quarantine hotels will work next week.
Are you
but as
frustrated
I say,
that there's been a delay to this since it was announced, and we've seen it working all over the world in lots of other countries? Are you personally frustrated that we haven't been able to get up and running with this sooner?
Well, no, because look, it's one part of a greater piece. Your very good question was about knowing exactly where the people are. The passenger locator form, now you will be refused by the airline to get on a flight if you haven't filled in a passenger locator form. So we know exactly where you are, so we can check where you are and that you are quarantining, and you get fined. And I make no apology for the 40,000 fines that we've issued already. Okay. But as I say, it is one part, and next week you'll have the operational plan of how we are implementing the hotel quarantine, including the other thing we've done. It's worth remembering for your viewers, in January, Germany and Canada had to also review their border policy. So every country is looking at this rapidly and making those adjustments so that we protect the nation as we vaccinate as fast as possible.